Want to thank ATI for helping to support the show. They're a sponsor, and that's actually where our guest today comes from. Tom works with ATI, and we get into some really, really cool conversations about things that I didn't think a whole lot of before PT school. And then you get to PT school, and I was told to think about these things like all the time. And some of the topics we touch on are mentorship and reflection. And that second one, the reflection thing, and we'll get into it, I ran away from as quickly as possible. I did the bare minimum in terms of reflection in PT school. And ironically, Tom's got some really great insights because of a secret weapon. And you'll find out who and what that secret weapon is in terms of reflection, why it actually doesn't work for most of us in PT or anywhere, and how to improve it. The secret weapon is pretty brilliant too. So thanks to ATI for helping us to support the show. They're one of the leaders in clinical research within the profession of physical therapy, with all 900 plus ATI clinics placing in the 100th percentile in CMS's merit-based incentive program for the second consecutive year. So if you want to join their team and jumpstart your new career, visit atipt.com. That website again is atipt.com. So without further ado, Tom Denninger.
So I think that driver comes from a want to develop, a desire to help people, but also a deep-seated insecurity that if only I can get to the next shiny object, then I'm really going to be helping people.
Well, I do pretend like I'm the professional. I just sort of make it up as I go along. But Tom, welcome to the show.
Thanks for having me, Jimmy. Excited to be here.
I'm pumped to be here. This is a topic I don't think I ever actually thought about mentorship formally until I came to PT. Like in radio, it was really like find someone who like is smart. Maybe they're on their way up. Maybe they're, maybe you find someone who's bad at the things that you're good at. And that's how you get in their good graces. You do the grunt work for them and they'll take you along for the ride. But as I got into PT school, it really was like, oh, people are so vastly different and this profession is so vastly wide that picking the right mentor or making sure you're being sort of thoughtful about it was really, it seemed to have a lot of importance. It came up a lot.
The interesting thing is I think in a lot of other fields, they talk about mentorship without calling it mentorship. So it's a pretty ambiguous term that I think means something a little bit different to everybody.
Yeah.
Right. In a lot of ways, it's, hey, do you have access to a role model? Is there someone that you're going to try to emulate or learn from, someone who can help you progress in your career? I love the analogy of kind of you fill their holes, they'll fill yours. But I just think part of where we go wrong with it is folks get into PT school and it's mentorship. Make sure you got mentorship. Hey, don't talk to someone that doesn't have mentorship, all those things, but no one really defines what that is.
Right.
And that can really lead people astray because you being a mentor, your definition might be completely different than mine as being a mentee. Right. So, okay, we check the box. There's a mentorship process, but hey, that relationship isn't going to go well because what we're looking for is very different.
Misalignment. I remember this was probably and it's funny how when the collective we or a big group of people start talking about something, next thing you know, it's the buzz thing. And I'm going to say it was probably 2016, 2017, because that's around when I graduated PT school. And this word mentorship was coming up. And I would love to have some data on this, but that ain't my jam. But there was this spike of people like selling mentorship. Like quite literally like, hey, I'm a person who's been a clinician for 20 years, join my mentorship program for $200 a month. And there was so many of that. And I couldn't have told you why exactly. It just felt icky. But I remember just looking around being like, I feel like we're eating our young here. Like we're just selling them stuff. Like, hey, you just graduated school. Let me tell you 9 reasons why you're going to fail unless you hire a mentor and do this. And so let's start by saying this. What you just said, we need to define it. So bold statement, mentors are not teachers. There's a difference there.
I would agree.
So how do you personally, Tom, this is your your operating definition of mentorship. How do you define it? And how do you see it different from what we're probably used to, which is traditional teaching methods?
Mm-hmm. I think the base definition is about someone who's invested in you as a person and a professional. I think, no matter where you want to go with it, whether it's monetized like you described, if it's casual, if it's formal, hey, this might go well if we start with, hey, you're invested in me as a person and my development. Might shape a lot of different ways. Hey, what does mentorship mean for me? What am I looking for? Do I want something that's more formal? Do I want someone to go to when I have a question? Do I want someone to ask me questions? Do I want someone who thinks of themselves as more of the sage on the stage as opposed to the guide on the side? But
Right.
As long as we're starting with hey, I'm investing in you and I'm interested in your development, then we have a chance.
And all right, so now that we understand what your definition is, that's good. Because if someone's listening and they're like, that's not how I define it, you've just saved both of you time, effort, heartache, energy. Like, then this isn't going to work out because this is how I view it, this is how you view it, this is good. And then there's different ways and different places to get it, right? Because again, I told you, I heard, the big buzzword. I'd love to do one of those Google searches where it like shows you like the popularity of a word.
Yeah.
Because I feel like mentorship
and mentorship. I think you're right on spikes because
yeah.
I'm a 2008 graduate and it was like, pick a place where they're not going to mess you up, but then all of a sudden it really kind of became this like, what's the mentorship program? Who's your mentor going to be?
Gotta have it.
And then with anything, people figured out how to monetize it pretty quickly.
Yeah. All right. So now we figured out what your definition of mentorship is, right? So we can understand that. And just for people, like for context, for people listening, like you've been at ATI since what, 2015?
2015, came on board through an acquisition. Yep.
So you've been, and in your roles there, clinical, professional, and then leadership development for ATI. So it feels like getting your definition of mentorship, it's probably been shaped by, wait for it, other people, probably through some sort of mentorship programs, right? So just where you work, because you said in when you graduated 2008, it was like, just go somewhere they won't mess you up, right? You can receive mentorship formally, informally. You can get Absolutely. It where you work. It could be done formally outside of work or informally. So all these different ways, it sort of says, all right, now that we know Tom's definition and Jimmy's definition, someone else's definition, that's the what, with probably a little bit of why sprinkled in there, but also the how and the where should probably fit as well. How am I getting this? Where am I getting this? Is this on site? Like, I feel like it's not just one. Now we're going even deeper. It's more than just this buzz term, which feels like it was so blanket, but it can mean so many different things to so many different people.
Yeah, there's so many different shapes. So let's not bind it into one definition, right? Hey, it's a relationship between two people where there's mutual expectations of each other to just invest, and investment takes lots of different ways. So when I came out of school, I entered into a residency. So formal mentorship that's right. On site, right? That's part of Atrophy's requirements, right? That is one form of mentorship where you're going to treat patients together and you're going to ask me about my treatment decisions and we're going to come together and plan kind of our next steps and do all sorts of different thought exercises. That's great. I took my first kind of clinical job in one where there wasn't mentorship, right? Where I was starting a new clinic. It was going to be embedded with some docs, but I knew kind of who the key stakeholders and the people who were investing in me within that company, that I could go to for questions, that I had resources, and I was starting my manual fellowship. So I knew I was going to have that next level of formal mentorship, but this person's not on site, all the time. I'm probably going to go to their location and treat some of their patients and learn from what they do. But your mentor doesn't have to be a single person. Develop your cabinet. Right? You probably have a mentor that's helped you in the podcast game.
Yeah.
You probably had a clinical mentor. You have all these different folks that if we just start with this, hey, we have a relationship and we're interested in my development, all of a sudden it takes a lot of different forms instead of, No, a mentorship program has to be someone who's on site with you 40 hours, that spends 10 hours a week treating patients with you. Like, yeah, maybe that might be great. That might be cool. Right. But also it can be someone who you contacted through your state PT association who's interested in mentorship, or maybe it's the author of that article that you thought was really cool. And, after some professional flirting, hey, you digging me? I'm digging. Yeah. Can I just talk to you about some headaches or manual therapy? All of a sudden, this definition of mentorship gets really, really expansive. And I think that's enabling, instead of when we try to fit it in a box of it has to be, weekly, one-on-one, in person, a defined program where there's a curriculum. We've lost the forest through the trees. All of a sudden we're teaching. All of a sudden it's a program. It's not a mentorial relationship.
Right. Yeah, you said cabinet. And I remember I thought someone had put it this way, like, who's your Mount Rushmore? Because you look up to Mount Rushmore because it's this huge monolithic thing. It's up in the sky. And you said relationship, which needs to be two-way, right? I don't think I thought about it like that, which is there's less pontification, right? Pontification, professing knowledge is typically one way. But if you can have a mentorship relationship with a professor, that continues after class, because that's more two-way. And how do we grow? And then, also just being someone invested in you and not just, less transactional.
Exactly. It's developing that two-way relationship, right? Pontification, if that's really the hallmark, whether that pontificating is coming in person through the phone or through email, that's not really mentorship. Right. Hey, maybe that even started with a question. Hey, tell me everything I need to know about, cervicogenic headaches. Well, you need to read this, and don't consider this, and things like that. Really, the best mentors don't give a lot of information. Oh, they ask a lot of questions. So, well, tell me about what you know on that subject.
Right.
Where would you look to for other resources? Tell me about the problem that you're working through. Because it's not a matter of, here's the resource, read this and you got it. Mentorship is really trying to develop this kind of idea of a master adaptive learner. I can take this conversation, learn from it, and apply it to the next 20 or 30 cases. Right. So I'm not relying on you every time I have a hard patient.
And that scales. I say, as you say this, I was like, man, Sky Donovan, who's on the APTA board of directors now, and she's was my professor at Marymount. She hates when I say that because she's like, why don't you just introduce me as your friend? And because I'm like, I need to put it in context. But man, she was like the worst professor ever, because I'd ask her questions and she'd ask me questions. And I was like, but I want you to give me the answer. And she's like, if I give you the answer right now, you won't have learned anything except for this one little microscopic thing. And I was like, well, damn it. Yeah, but I want the answer. Yep. But that was a good relationship, because she was like, why are you asking this? Or like, what part of it, you don't understand any of it, or you don't understand part of it? Great. Which part? Or, okay, let's start from zero. Like, what is your understanding of this thing we're talking about? And these are all like great podcaster questions, right? Because they're all open-ended. They let the person you're asking drive the bus on it and tell me which way we're going. I mean, I had someone say, like, how many questions do you script out for a podcast? And like, for full transparency, I have every guest sort of fill out this form, right? But it's similar to what like Charlize Theron would fill out, or probably not Charlize, probably her like assistant, right? Would fill out like before she goes to talk to Jimmy Fallon.
Sure.
And it's like, I'm just looking for threads. I don't need you to write the questions. I don't want you to write the questions. That's my job, man. I'll do that. I want to know what drives you so I can pull on that thread and then get the most out of you. That's a podcast. Some people will call it a trick. It's not a trick. It's just like, my job is to get the most Tom out of Tom, even though he knows like, hey, we're being recorded, right? This is public, right? But it's similar to like that mentorship thing, which is like, what's driving you today? Mm-hmm. Can you script that conversation out? I don't know if you can. It doesn't feel very beneficial. If you did.
It sounds like facilitating, right? And the best mentors and podcast hosts and clinicians facilitate. They don't have all the answers. They don't need to have all the answers. And if we start with questions and you're trying to unlock something, good podcasters, mentors, and clinicians facilitate. They ask questions. And there's a bad way to do that. Like you can be annoying with questions like, well, what do you think?
Right.
And then it's a little bit, different, but hey, find the common ground, help the person be part of their solution, really enable them to problem solve now and in the future. But it also unlocks you as a mentor because you don't feel like you have to be the subject matter expert in everything. I'm sure the same for you in this role.
Yeah, I think I've talked about my theory on like interviewing or conversations. I call it the onion, right? Which is, having a conversation should be a lot like peeling an onion, where the purpose of peeling an onion, there's no pit inside. You're not getting towards anything except the act of actually peeling the onion. The act of having the conversation is the thing. It's the value. You've got to start somewhere on the edge. That's what I say. It's like a thread. Just find somewhere to start and then sort of dig in. Because if you try to cheat and you just go ahead and grab a knife and just slice into it, because I want to get to the middle, because let's just get this done, man, that just makes you cry, right? Because then your eyes just start burning. It's like, that's not the way to do it. The purpose of peeling the onion, the whole thing's onion. Like the purpose of mentorship is to have this conversation, because that's the thing that's actually causing the learning and the growing. It's not the answer to the question.
Mm-hmm. And it's amazing how often it can go wrong, because you can have mentees entering in a mentor relationship where they assume, oh, I'm just going to get taught.
Right.
Right. And you can have mentors who assume, oh, I just get to share my knowledge.
Right.
And, I suppose there is a format where someone who wants to pontificate finds someone who wants to be pontificated to.
Right.
But I think more often than not, after a little bit of initial, oh, so you're not just going to give me the answer, kind of similar to your Sky, story. You're like, oh, thank goodness, right? Because how unfortunate would that be if they're only going to give me what I asked for?
Well, that's Google, right? Which is good because Google's free. But if you're going to be in this relationship where you just ask a question, you get an answer, the thing is, it's a good business model, because how can you ever grow, and how can you ever grow beyond that? It sounds like from my view of that, you can't.
Yeah. You used the word transactional before.
Right.
I think that's exactly it, because here's the secret as it relates to clinical, CEU courses, or the information's out there.
Right.
Right. You don't do a residency, you don't do a fellowship because of this secret book of knowledge you're now going to have access to. You do it so you have a really good mentor who's going to challenge you to think and teach you to be your own mentor after a period of time, or once again, develop that professional cabinet so you can figure out like, hey, I think I got this okay with this clinical piece, but now I'm treating this different population, or, hey, now I'm taking on a leadership role, or now I want to get into podcasting. You're going to need to expand that and kind of go back to and make that Mount Rushmore bigger. But the hope is, hey, let's grow beyond each other, or at least evolve our relationship. I'll go back to your story about Sky again. Say, hey, can't we just be friends?
Right.
One of the most awkward mentorship things I ever had. So I had a professor, Dr. Kevin Choi, back at Sacred Heart University. He was a first-year faculty member the first year I was a DPT student. So he's only a couple years older than us, probably younger than some of the students in the class, and very professional. Incredibly upright, great instructor, but really, served as a mentor for me as a DPT student, would let me know he saw something in me. We engaged in a mentorship relationship. But then 3 years out, he's doing his manual fellowship and asking me if he can come down to the clinic and I'll serve as his mentor. I'm like, Kevin, I don't think I'm comfortable with this. No, it's great. Hasn't our relationship evolved enough now that I would have hoped that you stopped seeing yourself as just my student when you were a student, let alone now being removed from it. So hopefully mentors set that environment that we can evolve and grow and kind of evolve that relationship.
Somebody, I forget who to give credit to, somebody had a really great viewpoint, and they said you should bottom line have two mentors. One should be 10 years older than you, at least. One should be 10 years younger than you.
Sure.
Which is all, sometimes we're ageist in the reverse, in the younger direction, where, and I see this a lot in communications, where it's like, we're going to let the students and the interns, they're going to do social media because they get it. They get these apps. I don't know the Instagram. I don't know why people just decide to start putting the in front of everything when they don't get it. I don't know the Instagram and the face and how to do the Facebook. And you shouldn't just like say, well, you guys get it. I don't. Good luck. Right. You can learn a lot. And I said this in the first couple episodes of my podcast when one of my younger classmates said, what are you going to do when you're done interviewing all the, and I'm using air quotes for the podcast audience, what are you going to do when you're done interviewing all the super famous PT people? And that's when I realized his age, he was 10 years younger than me. I'm like, oh, you don't see it. Like, I truly believe you can learn a lot from pretty much anybody, right? I mean, I lucked out. First couple episodes, I had Sharon Dunn. Again, not really sure why Sharon said yes. I think she just was like, yes. And then she was like, I don't even know what then she probably Googled what a podcast was. But what I looked at was, I mean, you could say informally, I've got more than 1,100 mentors for a half hour each because I get to pick the ear and pick the brain of so many different people. It'd be different if I wasn't recording it, right? Because it'd be like, but I get to almost use that as like my, hey, do you mind if I have you on my podcast? But secretly, like, I kind of just want to learn from you for like a half hour. Like, do you mind if I dig in? And I luck out because someone said, hey, Jimmy, you stepped outside your comfort zone and learned a lot. I'm like, no, I stayed in my comfort zone, which is interviewing people, and ventured to places I was not comfortable around the profession. But if I had just done that just by knocking on doors and asking people questions, I don't think I would have been as successful. So I think like that even goes to show, like, I sort of turned a podcast into a mentorship relationship because a lot of the people I call up afterwards, after I've interviewed them or see them at conferences, and we have these great connections. Like, was not on, I'd love to say this was strategic. I was like, I love to write a book, how I built my 1,100 person mentorship network, right? But I didn't. It was a sort of a goof, but I sort of built it for mine, which reinforces what you're saying. It needs to fit both people or it won't work.
Mm-hmm. I mean, people have to be invested. That's where it starts. I mean, if we were looking at keys, we would say investment in each other and ask questions. And if those two things are in place, I would say more likely than not, you got a chance. It's probably going to go well. But if you don't have that investment, if this thing is assigned or it's done, out of, the voluntold, situation, which I think is where a lot of companies go wrong. Hey, right. Congratulations, you're a senior clinician. What do I have to do? You got to mentor people. I don't really want to do that. Well, I guess you're not a senior clinician. Oh, I guess I can do that. Well, I guess I can share my information. So now they're not invested in, they're not really interested in hearing what that person's experience is. They just want to give answers and feel a little bit more special. Right. And it goes wrong on the other side too. Hey, I've been told I need mentorship. I think I haven't figured it out, but I guess if I have to spend time with someone and ask questions, maybe quickly they'll figure out that, maybe I can teach them a thing or two, but that's it. People need to mutually kind of find themselves in the middle, be open to learning, not want to give answers, not want to, just have this check the box mentality that I think a lot of people have fallen into with the rise of mentorship, as opposed to really saying, hey, how do we make each other better? How do, in an effort to help these patients?
Right. You highlighted the importance of being able to ask for help in a patient, really with anything, but we'll stick with like the clinical patient model. It's important to learn how to ask for help with a patient, and then you have to know this is like why we make such a big deal about like second and third graders about 911 and stop, drop, and roll. It's like you need to know how to ask for help and where to get it and what to do if the situation arises. How to ask for help. That's got to be important for something like ATI, which is pretty massive, like a footprint, right? More than 900 clinics. How do you make sure of that's known by the people that work with you or around you? How's that made clear? Because if it's not, people are just going to sort of be like, I don't know, I guess I wing it.
Mm-hmm. Well, I would point to two things. One is people play differently when you're keeping score, right? Oh. So how do I know that I'm struggling? And I'll refer people back to the great conversation I had with Chuck Thigpen, my colleague, to really say, hey, outcomes are important. We need these things to be visible. They're not just for insurance or they're not just for documentation, be defensible. Like, you got to keep score, because that tells you where you need help. Because without that, patients are people pleasers, right? Very rarely did I ever have a patient tell me I sucked or I was missing the mark. But you know what? I sucked in a lot of instances. So, and if I wasn't paying attention to the objective data, they would just drift off because they didn't want to be rude, because people are semi-polite. You got to know when people are improving or not. So that's a piece. Have a scoreboard that's going to tell you. The other piece is asking for help is a skill. Weekly, I get emails. It's like, hey, can you help me with this patient that, has a total knee? And that's the message.
That's it.
That's okay. Hey, details would be important, right? Demographics.
Yeah.
What's going wrong? What have you done? What haven't you done? That people help you to some extent, or else, especially through email or through asynchronous communications on Teams or whatever, you get done with it and it was good, but then you're like, wow, that's a lot of effort. As opposed to, hey, how do you ask for help? Hey, Tom, I'm treating this patient. It's a 68-year-old male. He had a total knee 3 weeks ago. We're having a lot of trouble getting his knee flexion range of motion back. This is what I've done. This is what I'm thinking about doing next. Do you see any holes in my approach? Are there major things that could kind of come? Oh, I'll engage in that conversation all day long. So there certainly is a way to meet that mentor or that person that you're trying to engage with, to ask the question, to get help, in the middle, so that you give them something to work on.
Correct.
Right? It's not so ambiguous that by the time we arrive at how I can possibly help you, we're both exhausted in the process.
Well, one of those things, the first way that in that scenario where you presented the information, it sounds as if the person who's coming to you is like, hey, I need you to solve all this. Like, I'm dropping this on your doorstep, right here. Good luck. Like, I need solve this for me. So are they looking for help, or are you looking for me to help you solve this? I would love to be a part of this conversation, as you mentioned, but this isn't my place. This is my place to do the whole thing. And the other thing that made me perk up and take a note, and I rarely take notes, but for some reason I'm writing a lot of stuff down today with Tom, which is, have you ever heard the idea of bluff?
Oh, bottom line up front.
Military does this very, very well.
Yep.
Because as you mentioned, take score, right? Keeps it matter. People pay attention. People work harder to keep score. Police, firemen, EMTs, military, like, it matters, right? So they realize split seconds or misunderstandings can cost things, lives, or bigger. And bottom line up front is this concept, which is, don't bury the lead, man. So the second part of your example was, here's what you need to know for context, and then here's my whole, which is like, now Tom has more of a picture. Now I can give you I can fill in this little thing that maybe you weren't seeing or you didn't know. We get to the end a lot faster. But yeah, bluff, bottom line up front. It's also like in news, right? We call it the inverted pyramid, which is like, get the important stuff up high, right? Like, and then the details can be low. You know who's bad at this? 6-year-olds telling you a story about their day at school. They love that. They're like, you know what? Details first. Today, my friend Steve wore a red shirt and he's got a dog named, Fluffy. It's like, does this store have anything to do with Steve or Fluffy? No, we're talking about my teacher. It's like, okay, I don't know where we're going here. But that example is extreme, but you see where being able to know where help is, yes. And I like how you're like, okay, great. Now you know where to call. Understand how to ask for it, where you're not going to ask that person to burn too many, I don't want to say too many calories, but it's like, let's do this as a team. This shouldn't take 7 emails back and forth. It should take 2.
I mean, because, what you said there are so many people that want to help you.
Yes.
I truly, truly, truly believe that. So worked with different state organizations, the APTA or other professional organizations, and it's always about standing up a mentor program. And we always get tremendous volunteerism on the mentor side and very low uptake on the mentee side.
Really?
Yet that's what everyone's told that they need.
Right. Why do you think that is?
I don't know. I think it comes back to this idea of effort. to some extent, where no one's been taught how to utilize that help. So they enter in this relationship where it's like, that's awkward. Hey, I'm going to reach out to this person that I don't really know. They're not in proximity of me. Isn't it kind of weird that they're willing to spend some of their time with me anyway? Or when they have that experience, it's just not smooth. There's no rules of engagement that are established so that if you do go, hey, Tom, this is Ted from, so-and-so. I got a patient with back pain that's not getting better. Help? ?
Right.
And then they feel awkward about it. Hopefully I have the caloric surplus to kind of lean in, because if it's too hard and I'm stressed, hey, Ted, happy to help. Tell me a little bit more, maybe. Right. And then he's like, this isn't going to be helpful. So I don't know. I don't think I have the complete solve for it, but I just want to really reinforce for young professionals out there that there's a lot of people that are super excited to help or wish they were more utilized, whether it's from a professional, a researcher, clinical, any of these pieces. And you kind of talked about it. I don't know why Sharon Dunn would have done my first podcast, because that's who Sharon Dunn is.
Right.
But it's every speaker ever that you could pull from the CSM schedule. If you email those people, I will say you get a 98% hit rate on people coming back. Yes, I'll send you that full text. Yes, I'd love to outline how I got involved with this. People love talking about themselves, but they also like helping people. So if they can talk about themselves and help you, man, all day long.
I tell people all the time, like, really the layup of this podcast is I get smart and passionate people to talk about what they're smart and passionate about. And it sounds like, well, it's got to be more than that because there's a microphone and a camera and editing. I'm like, yeah, but the real the meat of it is get smart, passionate people who are excited to talk about what they're smart and passionate about. Facilitate that in a way that's like fun, and we have a beer, and that's it's super low, it's casual, but really it's get them talking about what they're smart and passionate about, and then get out of the way.
Sounds like a good business plan.
It's a pretty good business plan, right? Make it fun. But first of all, I didn't realize that about the surplus of mentors and maybe the negative or the lack of mentees, and that could be a process issue, right? If you want to look at like people, product, process. The people involved want the product of mentorship, but they don't know how to do it. I mean, I never even thought about it before we started talking. Like, make sure you know how to ask for help. It's like, well, that's easy. I just say help. It's like, well, no, think about it. When people come to you, they don't know how to ask, or do I just say, here, solve this, and I leave? It's like, no. That's a transactional relationship. Like, I want you to mow my lawn, so I will pay you to mow that lawn. The lawn will get mowed. But hey, could we have this back and forth, and I'll explain to you, I will show you, I will teach you how to do this thing, right? The fish analogy, I'll teach you how to catch a fish instead of me just going to catch a fish for you every single day.
Yep.
You have a statement that's experts do the basics really well, and a warning, don't rush to make your practice complex before you're ready. And I felt this and saw this. I feel like it's kind of come down, which is the idea is I want to have 10 years experience in 3 years. And that was that was everywhere. I don't know if it's still there, but I felt like it was like on my chest when I was graduating. It was like, join this, it'll accelerate this. Everything was an accelerator, man. I don't know how fast we were going back in 2016, but I felt like we were going real fast. We all wanted to be more advanced than we were, which is okay. That means you want to grow, but don't skip ahead, because then, this is the journey, man, but also learning the advanced thing before you know how to do the basics thing, you're not going to know how to use that tool right.
No, I agree. I think at the core, when we think about young professionals, they tend to lack confidence. You learn a ton in school, and how could you not learn a ton after 3 years, 7 years, right? So I need to have all the answers. And then I get into practice, and gosh darn it, this is probably harder than it looks, right? These people, they're being nice to me, but maybe I kind of have this, little bird on my shoulder chirping at me. You're not that good. You're not that good. If only you knew how to, needle the intercostalis, right? If only you were the blood flow restriction king. If only you were a manual therapist. If only you were Reiki, we could go on and on and on and on and on. So I think that driver comes from a want to develop, a desire to help people, but also a deep-seated insecurity that if only I can get to the next shiny object, then I'm really going to be helping people. So, came out, did residency, did fellowship, and then, okay, I got a dry needle, right? That was kind of in the early aughts where this was kind of a new thing. Some states had it more than others. And I was like, I got to do that. But in hindsight, and this is not the old guy being kind of get off the lawn, to think about trigger point referrals and the mapping of that when you're still trying to figure out normal referral patterns, right? Oh my God, like melting the brain sort of thing to be like, wait, the infraspinatus can look like radiculopathy? It's just one of those things where if you're going to there and you're not foundationally sound, all of a sudden, if you picked up the hammer, everything's a nail, right? And everything needs to be needled until actually needling wasn't that good, but everything needs BFR. Actually, no, not everything needs BFR, but if we can get this scraping down, then we can really do it. That foundation in clinical reasoning that really gets developed through mentorship and reflection, then you can start bringing the tools in, right? But if you're not sound, you're always going to be chasing the thing that's going to make you a good therapist, and you're never going to find it.
It's a hamster wheel, man. You're doing a lot of moving, but not a whole lot of going anywhere.
Yeah, it's just seasons, right? Like, oh, well, I used to do that, but now I do this, and now this is the thing, as opposed to the best therapists I've ever met, and I'm pretty sure it's the experience, they steal from everybody. They do a little bit of everything. If you have a real campy person, hey, I bet you they've had 15 camps before they arrived at this one, and they finally gave up, kind of rotating through, because nothing has everything. So if you have that firm foundation, then you can integrate into and find the situational appropriateness. But if you don't have that base foundation, it's that hamster wheel. You said it right.
Yeah, something that just came to mind. I just did a quick video on this because I had a conversation with someone, and then I sort of just turned the camera on myself and gave like 15 seconds worth of reflection, which we'll get to in a second. And I was reflecting on a quote from Picasso. And the idea was good artists copy, great artists steal. Mm-hmm. And this isn't like go plagiarize your favorite author. This is like dissect what about this made me feel that emotion, right? And then put your own spin on it. So if my goal was, we were talking about an email, the organization I was working with was like, we got to do email marketing. And I was like, Jimmy's like annoying sometimes with questions, but because I push, right? I'm like, do you? Well, yeah, we have a bunch of emails on our list. I'm like, okay, great. So you have permission to call a bunch of people, permission to email a bunch of people. What do we want to talk about? And they were like, I don't know. So they kept drafting these things, and the people who were looking at them were like, no, not it. And Jimmy's in the middle, right? I'm clinical. I have a PT degree, but I'm also communications. I got that degree. So I'm in the middle going, well, you're not giving them good directions because you just say keep doing it again, but you're not telling them. You keep saying the meal's no good, but you haven't told me too salty, too burnt, like you haven't said anything. And on the flip side, I'm saying you need to do what you should be facilitating is what about this, the joie de vivre? What are you trying to steal? Mm-hmm. So then I pushed back and I go, great. Tell me about 3 emails you can't wait. You just die to open when you see them. Who is it? It's the James Clear or the Tim Ferriss or the Seth Godins of the world, or clinically, are there people that write blogs or podcasts that you're like, oh, every time this guy's on my list, or this woman, she just spits, Brene Brown, they just spit awesome stuff. Great. My advice was not copy Brene Brown, right? I want you to steal from her, which is like, what has she done to build a relationship with you? What we call an asymmetric relationship. Cause like, I don't know Brene Brown, but I read her stuff. So I feel like I know her, but I know I don't. What about that can you steal, right? Mm-hmm. And what is your spin on that? Because that's the thing that's scalable. Yeah, you could plagiarize a Brene Brown blog article once, but that's not scalable. Figure out what it is that you're getting or giving from that, and there's your Picasso. There's your good artist copy, great artist steal.
But I'll take that one step further to say you can copy and still have the same poor success rate because they started with an objective. They have a message. They have something that's important to say. And if you're just stealing format or context, right. I mean,
font,
there are copies of things that are of the Mona Lisa that are more engineered to be better, and they're not.
They're not.
Because there's not that objective. And we see that in learning all the time. We call it content first learning. Hey, and it actually kind of comes back to this mentorship piece. If I'm just saying, I know what I'm going to teach you, right? These are the facts. These are the slides. These are the techniques.
Right.
At best, people are going to be like, it's pretty good. Maybe I learned something. I don't know. If you start with objectives, if you define what success looks like and how you're going to measure it, then you have a chance to have good content. So you can copy all you want, but if you don't have an objective or a message, something you're trying to accomplish other than improve a click rate,
right,
you're still going to miss. You can copy all you want.
Right. Are we doing this to get this done, or are we doing, and that's where, it might sound mushy, right? Some people are like, this is mushy, but I start with emotions. Because if you tell me what you want, are we educating someone or entertaining them? Right? Because I work in a world of content. Those are the only two things you can do with content. The magic third thing is, can you be entertaining and educational or enlightening or informing or motivational at the same time? If you can, great. Then what does this do? Because if I say Tim Ferriss to you, you sort of like think like, oh, I kind of know what I'm going to get there. If I say Burger King to you, you kind of have an idea of what that organization is going to do with what that organization is going to provide. That's a brand. A brand isn't a logo because I can copy that. A brand isn't colors and fonts because I can copy that. It really is, what am I going to make this person feel like? Before, I wrote this down. And I want to make sure I sneak it in. Because back in mentorship, we were talking about it's not, it can be formal, it doesn't have to be. And it can be sort of along the path that you didn't see. You've seen the movie Rudy. Who was Rudy's mentor in that movie? It was, he had the priest, right? He was sort of a mentor. He had his buddy, which was actually Jon Favreau, right? Yep. Who he was his tutor, right? But it really was Rock. It was the groundskeeper who taught him these lessons that were the foundation, even culminating in Rudy. And by the way, I'm going to spoiler alert it, but if you haven't seen Rudy by now, I don't care.
30 years.
You got to go back.
Statute of limitations have run out.
Culminating on him, Rudy's going to skip his last practice, and Rock is just like, you're 5 foot nothing, 100 nothing, and you survive the workouts at the best college athletes. And he's like, and he marches right on the field. You wouldn't have predicted that mentor. You wouldn't have said, oh yeah, I'm sure the groundskeeper at Notre Dame is going to be my mentor. But he filled his gaps and vice versa. He saw, because also it worked the other way, because he finds out Rock was a player and he wound up regretting some of the things. So he got to live again through him. That's never happened on a podcast before. The lights just went for the podcast. So the lights just went out. Oh, you got motion sensitive lights and you haven't moved around in a while. Got it. So that made me think. I wrote down Rock from Rudy and I was like, yeah. I wanted to make sure I snuck that in there. So you
never know. So don't just look at the formal program.
It's not.
The persons that, you never know who's going to step into that role, and just make sure you're open, to learn from those individuals. Because if Rudy was like, just the groundskeeper, just the clinician that's 1 year out or ahead of me,
right?
Or just the person that hasn't, taken a CE course in the last 20 years. No, they can't. You'll be amazed. Just learn from everybody. Just have it open. Make sure you're supported. I think all the ask for mentorship and programs and this comes from a good place of, I want to do well. I want to take care of patients. I want, I'm used to having formal learning. I want someone who's going to help me transition into this adult learner. But it can make so much sense for it to be different than just someone who is voluntold that's going to answer your questions, right, or at least tell you what they want to.
All right, last thing before mentorship, and then I promise I'll shut up and we can move on to reflection, right?
Hey, all good.
I will give, especially because you just said after you do this for 7 years, right? But it's 12 years before that. So listen, if you've gone through school every year, because after second grade comes third, and after third, it's always a process.
Yep.
And this is going back to your saying, you got to know where and how to ask for help, right? So there is this like, well, I've always just had a guidance counselor or an admissions counselor. There's always been someone there. This is an example where you get to sort of pick if you want that, but you have to do a little bit of the work because this is investing in you. And this, if you find the right fit for a year, a decade, the return on investment is there. But I'll give almost a pass to the students coming out, because they've just always been given something, right? To their own, this is just how the educational system works. Every year I go and the next grade just has a bigger number, right? And there's always a person, right? You get to start creating your own network. You get to start creating your own Mount Rushmore. Use that opportunity and be thoughtful about it.
Absolutely.
So when I say reflection, which by the way is something that I did 0 times during PT school, because who the hell has time to do it? But I do it now more and more. I wish I did it more in PT school, but I don't. Maybe I was just like, I don't have time to pump my tire up. I got to keep pedaling. It's like, well, if you pumped the tire up, you would have went faster. So when I say reflection, you think it's the most important thing you can do, and like mentorship, it's different for everybody.
Mm-hmm. And I'll first set the stage. So my wife is completing her EDD. She's faculty at Bowling Green State University, and this is her specialty. So I thought I knew what reflection was coming out of residency and fellowship. And if I sound smart talking about this, it's just osmosis, absorption.
Smart man.
Don't want to, but I'm stealing from many, especially one very close to me. But we go about teaching people how to reflect the complete wrong way, because
Really? Okay.
Everything you ever did for reflection in PT school, what was it? What did it look like, Jimmy?
They were all like, hey, at the end of this week of clinical, write 300 words on reflect. I don't know. Like there was a prompt sometimes.
Write this Blackboard post.
Yep, that's what it was.
After you do something, hey, put it down. And it's funny, kind of from an academic kind of circle perspective, tons of research. Hey, reflection is key. Reflection on action, reflection in action. This reflection. But when you ask students about reflective assignments, the number one thing they'll tell you is feels like busy work.
It did. That's
like busy work. It's checking the box, blah, blah, blah. And then I saw this, and then this person did that. And it's so, first of all, we're not explicit with our instructions, right?
Correct.
We don't say this is important to you because, right? We never establish that with them, right? What's in it for them? It's always, hey, reflect about this. You need to do it. Oh, so it's just you making sure that I log in once a week and that I actually went, or something along those lines. Not only do we tell them that it's important for them, we also don't present it in a way where it can look different, right? No clinician, I'll hedge, very few clinicians reflect by writing in a journal. And then I saw Mrs. Smith today, and she came in with this. I think there's people out there that might do it, and that's wonderful. But for most clinicians, it's the 15 minutes on your commute before you turn on the radio to think about what happened. Why wasn't that right? What could I have done better there? Today, I give myself a C. I could have done better here. I need to remember to do this. I need to write that down. Hey, that's probably the most common form of reflection, just thinking about the day. Maybe you're writing it in a voice to text on notes, or, hey, maybe it's talking to somebody. Hey, let me talk to you about that patient. Oh, so mentorship and reflection kind of go hand in hand. But we get it wrong because we make people think it's busy work, and then we don't give them the opportunity to do what they will do in the future, to really hone their skills for it in a safe place in school, reinforce the importance of it so that they can actually have 5 or 10 years experience instead of 5 or 10 first years of experience.
Right. So any tips and tricks? Like you got the direct line to like some good reflection info. Like if that's not the great way, and you just described exactly what my reflection experience was, but meanwhile, I do it now in the shower, on a walk, leaving a meeting going, that didn't go quite as well, but let me, instead of doing this, let me do this. What did I do? And I do that more now in the 7 years since I've been out of school. What would advice be to make it better, either in school or how to, because again, I would never write in a journal ever, even now. So what tips do you have from the master there?
Yeah, you know what? That's probably a good question for her. Maybe that's
Yeah,
part
bring her on
two.
the show.
But hey, I think make sure you realize it's important and you prioritize it. You figure out what works for you, because it's going to look different, and that's okay. But it is a skill that's practiced, right? It's kind of like meditation, right?
Correct.
Can you focus on something? Can you block out the noise? Can you do serious self-assessment and really have some visibility, right? Scoreboards help. By the end of the day, was I kicking the ball trying to dribble it, or did I score a lot of points?
Right.
How did I feel like I did? Because sometimes our perceptions of ourselves are a little bit divorced from reality. I think prioritize it, figure out what works for you, and practice it is what I would say. But probably there's better answers to it.
Well, I like also you referenced the last time we had, and people listening should go back to listen to the last time when we had Chuck Thigpen, also from ATI, on when he talked about measuring and why it's important, but also it's important to be clear on those things. Everybody, it's not only good when the boss can only see the scoreboard, and then I'm just hoping I'm doing well, and then all of a sudden every quarter I get to see it, and it's either yay or nay or in the middle. It makes me think of I play like beer league hockey, right? I play like Wednesday night hockey at the rink here. And one of my buddy's kids is always on the bench. He plays juniors, and we always let him do like the speech before the game. And so what are we going to work on today that we didn't do last week? And he's like, you should score more. And I was like, got it. But then I started pushing, like, jokingly, but it's like, all right, how do we do that? He's like, you shoot more. And I was like, okay, how do we do that? He's like, you pass better more. I was like, see, you're getting it. It isn't the scoring, man. It's the thinking. Because before passing, it's being aware. So be aware, then pass, then shoot more, then we score more. I was like, okay, but that's a simplistic way of looking at it. But just paying attention to the scoreboard is good. But how do I affect that? How do I affect that, right? As a team, but me personally, that's the way I look and reflect, right? I mean, someone was giving a talk the other day on if you only review the questions that you got wrong and not the ones you got sort of lucky on, it's like, man, you are missing. You're going to be rude. You might be rude awakening on test day because you had this this inflated view of how much you knew, and not a real reflective view of what you did or didn't know. Dude, do it now when you're in the safety of the sandbox testing it out, and not later when you're being tested. And that can go for the NPTE or life.
I agree incredibly. Actually, you're tempting me to shoot my parting shot, but I'm going to show some restraint there. But yeah, absolutely right. You talked about the hockey, and I love that. But so much of what a mentorship situation can do, or so much of what reflection can do, is what are the lead measures or actions that are going to bring about the result that I'm looking for. Right. And pit a tail on a model, whether it's 4 disciplines of execution or Simon Sinek, start with why. If you're just have a system, I don't think one is better than another, but if you're thinking about what you want to achieve and you do that backward math about what's likely to bring that about, hey, all of a sudden you have something to action against.
Yep.
And your actions can become habits and behaviors. And then all of a sudden, if your intent is just be better for patients, and you figured out that the number one way to do that is to make sure you're revisiting their goals so they stay engaged in their program, all of a sudden that's going to, and you've changed your habits and actions and behaviors. And, now you're doing that really consistently. All of a sudden your patients are having more improvement because they're staying engaged in care, as opposed to drifting off when the pain in their butt is less than the pain in the butt of getting to PT.
Right. There's a story. I would get all these anecdotes and they get stuck in my brain, right? Little like fairy tale type things. And one was this group of guys got plane crash in the mountains, and they're freaking out, right? And then they realize one guy's got a map, and they go, okay, we got a map. Let's put together a plan because no one's coming. We got to get ourselves out of here. And they all say that we're going to follow this route and we're going to figure it out. We're going to get down there, figure out where they are. And there's some trials and tribulations along the way. They get lost, they get found, and they find their way out. And then they realize the map was actually for a mountain range 500 miles away. But the idea was sometimes having a process and following something is better than just sort of wandering around, right? So, you could look at the process and say, well, that doesn't make any sense. They just got lucky. It's like, well, they were working together. That was the process. So pick whatever you want, which can also go back to what we said earlier, which is you can go from camp to camp to camp. We feel safe when we're in a 3-day Con Ed course because when I'm done, man, on Monday, I'm going to be so much better. It's like, are you? Or are you insecure? Which, by the way, I always find that people who don't have imposter syndrome, they're the people I want to stay away from. Like, I actually want to go to the imposter syndrome person because it shows me like you want to be better. You think you need to be better and you're willing to put the effort into saying it out loud and being better. But yeah, a lot of people will gravitate towards the next 3-day thing. Find a process, something that you're comfortable with, and then realize that a process is probably better than whatever the next shiny process is.
Yeah. I mean, take it one step at a time, to go back to this idea of start with the basics. Take everybody for what it's worth, but don't blindly follow anything and overcommit,
Right.
or don't be in a rush, right? The foundations, the fundamentals are actually what helps your patients.
Right.
I think there's a couple things that certainly can help a group of patients that you previously might not have. But a lot of these things are how to keep the therapist engaged in the treatment more so, because
right.
At the end of the day, the systematic review says, hey, if we exercise people in a general fashion, they get better. Right. Hey, however you want to, skin the cat, approach it, things like that. Sometimes I think that's just for our engagement, because if you're not really invested and reflecting and thinking about why you do what you do, that clinical care can feel kind of monotonous,
Sure.
right? So now I can stick people with sharp things, or now I can scrape them and bruise them, or now I have the magic cuff. And I'm picking on those three, not because of any reason. It's just kind of the new things that I consistently hear about and see, and our therapists kind of continually utilize. And they're all great and important things with good physiologic background and evidence behind them, but not if that's all you're doing. If you ignore the exercise and education piece, you're just, throwing different stuff against the wall.
Right. And what I've found is the people that instruct these things, right? So, Owen's Recovery Science has been sponsoring this podcast for years. You ask Johnny, he goes, this is 5%, man. Like, this will help very specifically. This will not solve all issues. You need to be doing other things. I mean, this helps you on test taking. Never, always need to do. Red flag, man. You mean always? Always. Every time. Because as soon as I find one reason we don't do it in a situation, that means it's gone. Always? No. All right. We're going to do 3 questions. Then you're going to unleash your parting shot.
Fair enough.
You ready? All right. 3 questions brought to you by our friends at, ATI. One of the leaders in clinical research within the PT profession is ATI at all 900 plus of their locations, placing in the 100th percentile in CMS's merit-based incentive program for the 2nd consecutive year. That's great work. Hit ATIPT.com if you want to join their team and jumpstart your new career. That is ATIPT.com. Now, we've changed up 3 questions. If you listen to the show, we used to ask the same, or we kept the questions the same for a little while, because no matter how many times I ask the questions, the answers are always different because the guest is different. Now, I went out and I created these question decks. So I've got decks of these things, and I pulled 3 at random. So here we go. Question number 1. Oddest job you ever took to earn a buck in your history. Oddest job you've ever taken to make some money.
Ooh, I spent one summer as the gate attendee at a boat ramp for the town. It was odd in that I spent most of that summer sleeping in the booth, or figuring out that many people come to launch their boat without a pool, a ramp pass, and that could quickly make me some extra bucks beyond the minimum wage that I was making. So how about that?
Man. As little as I know about boats, I got some friends who have them. What I also thought you were going to say was you figure out real quick how difficult it actually is to back up a boat in a trailer.
Absolutely. When I was conscious, and especially if someone had paid me on the top, I would come out and direct. And that summer had 2 cars get pulled into the lake, and tow trucks were needed, and also had a guy break his thigh because the boat dropped on him a little prematurely before the water could catch it. So it was an eventful summer when I was conscious. So
boat ramps, no joke. Second question: if you could try out a job for a day just to see if you like it, which job would you choose? What's something maybe you do, just to give it? You can't do boat ramp. You've already done that.
So I'll channel my wife again, but specifically her uncle, who is a hydrologist. Worked for the National Park Service for years and years and years, would go on, these 7, 10, 14-day backpacking where he would have to map out all the water features in a national park and then make suggestions based off erosion patterns and things along wild habitats, things like that. And I don't know about you, I find that fascinating. I'm drawn to the wild despite being far away from that being my lifestyle. Favorite show is Alone, if anyone's kind of out there. Also, I think just water is cool. It is cool. I don't know if I could do that for 30 plus years like Carl did, but
try it.
I'd like to try it for a day.
That sounds pretty cool. I had a buddy who was was one of the athletic trainers for Ohio State baseball, and then now he's like a national park ranger. And I remember thinking but you were always with people and traveling people, and he's like, nah, man, I just dig this. And I'm like, good for you for recognizing that, because now he's he's just infinitely happy.
Hey, there you
go. Third question on 3 questions. What do you consider as the most important piece of furniture in a house? Did not see this one coming.
A couple different ways to go there, but I'll go simply and cleanly to say that the bed, because if you're not sleeping well, nothing else goes.
It's a very PT answer. Very physical therapy answer. All right, that's you're off the hot seat for 3 questions. Again, brought to you by our friends from ATI. Hit ATIPT.com if you want to jumpstart your new career. All right, now the moment you've all been waiting for. Here is your parting shot. Parting shot, your last chance for either a mic drop moment or a soapbox statement. You said you had it holstered for us. What do you got for us?
Yeah, showed restraint. So the best advice I was ever given, and it relates back to the hour plus that we've talked now. People, reflection is the most important thing you can do. But people tend to only reflect when they fail. So if you really want to unlock that piece and really kind of get going, reflect on when things have gone well, right? It's very much that item that you said before. Hey, review the whole test because you guessed on a bunch of them. And if you don't learn from that experience, hey, just because something worked doesn't mean that you did it right. Right. And there's still a lot of opportunity to learn. So reflect on every occasion, be intentional about it. Don't only do it when you fall on your face.
Love that. Great insight for the parting shot. Thanks so much for the time. We touched on a bunch of stuff that I thought was obvious because we've talked about mentorship before, but you've made me think about a few things on a topic I've talked about before in different ways. I was like, ooh, didn't think about that.
Try to bring something unique each time.
Good. Love it. All right. They say the best conversations happen at happy hour. Thanks for coming to ours.